Welcome back to First Edition. The private lives and behaviors of Johnny Depp and his ex, Amber Heard, are being discussed very publicly as a result of an ongoing defamation lawsuit. Of note, many behaviors are being described as being traits of personality disorders. But what exactly are personality disorders? Well, here to discuss in this week's Guest Site with Dr. Janine is Dr. Janine Hubbard. Great to see you again.
Well, I was going to say thank you for my week off, but it's awfully nice to be back.
I don't know if you've been watching this. I've been watching bits and pieces and reading a lot about it, which I maybe shouldn't be doing. It's not my business. But personality disorders being talked about heavily. So what is a personality disorder?
Well, certainly probably one of the most poorly understood, highly stigmatized, and terms that is just tossed around at will in the media and like in movies and TV without really understanding what is being described. And like I say, it's often used to describe women, and it's often done in a really derogatory way. So I thought it was really important just to clarify in its most simple terms. And again, I'm just hitting the tip of the iceberg tonight. So we all have personalities, right? Our personalities are basically how we think, how we feel, our behaviors, how we interact with the world, and that they all go on a spectrum. Some of us are more sociable, some of us are more competitive, some of us might be more assertive, some of us, crave closer connections with people, and others are, happy to be a little more perhaps introverted. That's normal. We all do that, but an individual with a personality disorder exhibits behaviors, thought patterns, interpersonal relationships that really fall out of the sort of the societal norms. It's a distorted pattern of, again, thinking, feeling, and actions. And there's a wide range of them. That's the other thing. I'm just alluding to some of them here tonight to let you know some of the range. But really what it means is it's a person who has like an altered understanding. So the way they understand the actions of others, they might be, they're far more likely to misattribute them, or the degree of the reactions that they have. So it often falls, we've got three different clusters. One of them tends to be more odd, unusual, kind of really erratic kind of behaviors. The second, which is what you see definitely described in mass media, is the overly dramatic, the overly emotional, the impulsive, erratic kind of behaviors. And then the third tends to be much more fear-driven behaviors. But all of those together encompass the different types of personality disorders. And amazingly, about 9% of the population can be diagnosed with at least a single one, if not multiple ones. Important to remember, if you're reading up on any of these, we don't diagnose them until at least the age of 18. Because personality is continuing to emerge, and if you read some of the descriptors, boy, they sound like every teenager out there. So we do not prematurely label, but we certainly do see the emerging symptoms in adolescence.
Do we know what causes a personality disorder?
A little bit, in essence. Genetics, environment, and certainly a history of trauma are kind of the known factors that are going to increase the likelihood.
Can disorders be treated?
Sometimes. I'll be honest, because it's a lifelong pattern of interpersonal relationships and your understanding of the world, oftentimes individuals with personality disorders don't appreciate that the way they think is different from the rest of the world. They're far more likely to say, no, it's your problem. You're the one who isn't interpreting the situation accurately. But in other times where there is huge emotional distress that goes along with these patterns, and sometimes it takes a real low, and sometimes it takes really supportive family or the right therapist, but they can be treated. Generally, it's treated with therapy, and we're talking intensive long-term therapy, because again, you're helping them to understand how their thoughts might be different from the rest of the people around them, how their actions are influencing and hurting both themselves and others. Medications sometimes used for the secondary effects, because oftentimes you do develop anxiety, depression, substance use disorders as a secondary piece, but it can be a very tough therapy, no question, but it is treatable.
Well, Dr. Janine Hubbard, we are out of time, but thank you so much for coming in. I'm sure we can talk for many hours on this.
Absolutely. Looking forward to all kinds of interesting topics in the upcoming weeks.
Okay, thank you.